So I'm here demonstrating the L175-01R Resuscitator Kit from Life Support Products by Allied Healthcare Products. This kit is a self-contained unit that can be kept boxed up and can be deployed when needed for any respiratory emergency, and it's got all the components to handle pretty much any respiratory emergency that may happen. I've talked about unboxing it and how to assemble it in previous videos. I'm going to talk a little bit about how to use the product or what each of the components do as far as use. I'm going to start kind of with the basics, and the most common is likely just a respiratory emergency where somebody is breathing but they need supplemental oxygen. Somebody's having trouble breathing. In that case, it comes with this standard disposable simple oxygen mask. And to do that, you're just going to hook this mask up to the low flow port on the regulator. You're going to make sure that regulator is turned on and that you have pressure in the regulator. And then you're simply going to dial in the flow that you would want to put on to apply to the patient to supplement the oxygen, or supplement their breathing with enhanced oxygen. And they'll just put that on their face and get supplemental oxygen. That's the usually the most common scenario. The next scenario we'll have is where a patient is breathing, but they need 100% oxygen. They really need help breathing. This kit comes equipped with a demand valve, and again, we make several versions of the kit with different demand valves. This one is the L175 demand valve that comes with this kit, and it delivers 40 liters per minute flow. We have another one that delivers 160 liters per minute flow. The L175-010 kit comes with one that does 160 liters per minute. In any case, this is both a demand valve and actually you can trigger it to provide ventilation. But the way this will work is you'll hook the mask up to it, and if you have a patient that is breathing, you'll notice you don't have to push the button. They can put it up to their face and breathe. When they actually take a breath, it'll trigger the demand valve and provide 100% oxygen to the patient at whatever breath size they need. So that will supplement somebody who's having trouble breathing that needs 100% oxygen. The next scenario we have is where a patient's not breathing. And where a patient's not breathing, you can do this via a mask, or if the caregiver is trained enough to do an endotracheal tube, they can put an endotracheal tube in. But we're going to use this test lung to kind of simulate a patient who's not breathing, in which case this demand valve would be used to deliver breaths. And they'd simply hold the trigger down, deliver those breaths, and provide ventilation to the patient. Now, you'll notice, if we hold it down, it's got a relief valve in there that'll prevent the demand valve from overpressurizing the lungs. Okay? It's going to provide breath until about 60 centimeters of water, but it won't go over 60 centimeters of water. That's a safety feature on this ventilator to prevent lung damage on this demand valve. So that's the demand valve, probably the most important factor in this kit. But the other respiratory emergency that we want to deal with occasionally is a choking, or where somebody can't breathe, or a combination where you need to use a demand valve, but you also have to provide suction to that patient. Instead of having to use a separate suction unit, this resuscitator kit has a oxygen-powered aspirator. And this uses oxygen and blows it past this fitting to create a suction, creates a venturi suction. And it'll allow you to quickly clear any particulates from a patient's airway. In the kit is a suction catheter. They will simply open this. I'm going to use this water bottle just to demonstrate how the suction works. They're going to open this. They're going to insert the suction catheter into this tubing. If you have a larger piece of suction tubing, you can also put it over the outside and use standard suction tubing with a catheter to create suction. But the way it works is they're simply going to push this button, and when they do so, it creates suction and will suck out any aspirate or particulates that may be in the patient's airway. So what you can see here is that you have a complete resuscitation solution that's all boxed up in one kit. When the emergency is over, they're simply going to turn off the regulator, close that valve. They're going to purge it until the pressure is released. That way they can clean up the accessories and they can go and get everything back to where it's supposed to be. But then these store, once this is cleaned out, this will store back upside down in here. Everything stores together, and when they're done and everything's been cleaned off or replaced, they're going to go and they can pack that kit back up. Here, pack the kit back up, and it's ready to go for the next emergency. So this is a demonstration of the assembly and the use of the L175-01R Resuscitator kit, and the variants of this kit work exactly the same way.